Overuse injuries are caused by sudden changes in training where some tissue of the body is not ready to handle the stresses that get imposed upon it. I have here today with me Jess Horrocks, Dustin Williams, and Stash Dabrowski to help us understand a little more effectively how the mechanics of our running relates to the likelihood of injury and how we may be able to get healed from those injuries. So first off, Jess, would you introduce yourself?
Sure. I'm Jess Horrocks. I'm working with women's cross country and track and field at Brigham Young University as a licensed athletic trainer.
Dustin.
Dustin Williams, the head athletic trainer with track and field at BYU, as well as the medical service chair with USA Track and Field.
Stash.
And I'm Stash Dabrowski. I'm a physical therapist and athletic trainer that works with BYU track and field and cross country teams.
Thanks for joining us today. We'll do a few little questions with each of them, and hopefully you'll gain some better insight of how biomechanics relates to injury.
An injury is interesting. It's very kind of subjective on each person on what they feel, but it starts with damage to tissue within the body. Oftentimes how I kind of classify injury is if an athlete has to compensate or basically have a limp with their running normal gait pattern, that to me is an injury. That they have to change the way they normally run and compensate, and so now that whatever may be hurting, I would classify that as an injury. If they're changing their regimen too quickly, so if they're increasing their mileage too quickly, that can be a cause. Terrain can be a cause. So whether they're running on flat surfaces or had been running on flat surfaces, now they're running more hills, especially downhill, and they're not used to that. That can cause an injury. And then footwear can be another cause of that. Footwear is a big thing that can really help us right now because there's a lot of options that have increased in the last over 10 years. We have a lot more customized type footwear, those type of things, but it can be challenging to figure out what is the best shoe for you, and what shoe fits good for you may not be good for your teammate, and that can be challenging. But those are a lot of times can be those challenges, and I would say with footwear, sometimes changing footwear can cause an injury because your body has to adapt, and it's not able to adapt accordingly.
So in running specifically, we talk about changes in footwear, we talk about intensity change, volume change, but what's not really talked about a lot is anatomical structure, and athletes that are already at risk coming into running without all of the factors that we have of running. One of the big things that is also not really talked about is we talk about different changes in footwear and changes in shoes, but we don't talk about what specifically types of shoes or how often to change for mileage, and that's all dependent on, again, going back to the intensity, the load, the type of athlete that you're working with.
When I first think of that, I'm thinking about gait retraining. And there are certain things that we're looking at when we are looking at someone on their run, or if we're doing a gait analysis, that we can adjust. One of the first easy things, 9 out of 10, most physical therapists will talk about if they're doing like running mechanics or an evaluation, they're looking at their cadence or how many steps they're taking. And most people that'll be their first thing that they try to address. Now, if it is worth addressing. Now, there isn't a magic number, but somewhere between the rate of like 170 to 180 steps per minute, so each footfall, is kind of this number where we're seeing a little better or decreased risk of injury. So if someone is really lower, on that like 150, 160, we might look at seeing can we change their step rate and increase their cadence a little bit. And when we do that, we're not going from 160 to 180 immediately. It's more of a 5% increase and see how their body reacts to that. In addition to that, second one that I see more often is that there's a lot of crossover with their stepping. And that's one that we can try to gait retrain, where we'll go on an indoor track, use those lines and say, let's try to see if you can run and keep maybe your big toe on the end of each line or the edge of each line, and try to have a little less of a crossover step when we're running. There are other things that we could look at, but just from the human eye, without seeing ground reaction forces, with all the biomechanic information that you get in your lab, step, rate, or overstriding, and then crossing over are two of the most simple ones that we might try to retrain. And there's some good data looking at how gait retraining can decrease patellofemoral pain.
I think the key thing is understanding what they're doing currently, and if you're going to make changes, make sure it's slow and kind of not big changes right away, and just kind of make it slow and try to be able to adapt to those changes, I think is key. Changing someone's gait can help, but it can also hurt. So it's a lot of times with it, you've got to start with that slow change and see how if it's making improvements. And there are some times where they'll kind of have a dip, and then they make those improvements. And so sometimes you have to be patient with that change as well. I think the biggest thing can be with utilizing strength training to be able to help make those changes versus just changing the mechanics per se. And then because with that, doing strength training, it can make those changes kind of slowly because you're not going to increase strength right away. It's a slow change, and that helps as well.
I love working with our freshman athletes because they come from a high school setting, and in the high school there's 800 athletes, there's usually one athletic trainer, there's not really a great strength program sometimes, and so they come in with some strength deficits that put them at risk along with their anatomical structure for further injury in their collegiate career. When I know that I have freshmen, that's one thing that I like to look for is where are our strength discrepancies. A lot of my manual muscle testing is weak in most of my athletes. Even if they've been here, they're a lot stronger, but they still continue to work with our personal trainers, our coaches to get stronger. And those are things that we communicate. But specifically to our freshmen, we see a lot of hip deficit, glute deficit, and hamstring deficits. The ratio of hamstring to quad muscle structure isn't there. And so when we're using our quad too much and our hamstring can't back that up, we're seeing a lot of hamstring injury. When we're seeing weak hip and glute muscles, these athletes typically will come in with some sort of hip soreness, hip strain, tightness. I work all day on piriformis releases because of this reason. But what's interesting, the most interesting about our strength deficits is it affects not just that area where we have strength deficits. A lot of my athletes have come in and said, I have knee pain. And if you're not looking correctly at the ankle, the foot, and the hip, you're gonna miss it. Because although they present with a knee injury, the cause can be up the kinetic chain or below the kinetic chain. So looking at it from a full perspective and evaluation really helps us, yes, treat the pain, but then we gotta treat the why. We gotta see what is causing our athletes to end up with these overuse injuries. So to supplement that, stretching is so important. Strength training, so important. Recovery, recovery, recovery. I can tell you that in the first week of being here, I talked a lot about recovery with my team. And in about a week, I heard a lot less complaints of just little ticks that we get while we're running. It seemed like people were all of a sudden feeling so much better and able to continue their workouts. And as they've gone on through their season, a lot of athletes, I can tell you right now, if they were not doing strength training and if we were not paying attention to where their deficits were, they would not make it through their full season.
I feel like I see some of these habits or these biomechanical tendencies more often in females than men, specifically with like the hips and knees caving in, the ipsilateral hip drop in general. Tend to see that more often in females. Males also have those issues, but I definitely see it more commonly in females. So it's something that I can almost say every female on our, especially freshmen on our cross country and track teams, like we need to work on improved hip stability, whereas men, I don't have a number, but I won't be as confident that this is 100% something we need to do.
The differences with men and women in athletics, it wouldn't be right unless I brought up the female athlete triad or red S syndrome. So with the female athlete triad, we have low energy availability, menstrual dysfunction, and decreased bone mineral density as signs and symptoms of this female athlete triad. When any of these things are not correctly functioning, then we're getting this like low bone mineral density. With low bone mineral density, that can lead us to stress fractures, stress reactions, different muscle strains. And so that's one of the big things with our women is not only are men and women built anatomically differently, but also their bodies function differently. Menstruation is a huge part of health, and being able to accept that getting your period every month is very, very important. Being able to realize that There are different phases of menstruation that are ideal for working out, that help you gain strength benefits. There are different phases in the menstrual cycle that are not the best to work out. You are not going to get the best gains from that. So knowing that knowledge, it's worth exploring with my athletes to see where exactly is their cycle lining up. Is their cycle happening? If it's not, that's something we need to talk about. But with that female athlete triad, that bone mineral density is huge. So if we're lacking in bone mineral density and we don't have proper anatomical structure and we have strength deficits, that bone mineral density that we're lacking is going to crumble. That is a main problem.
Good question. So a lot of it comes with a little bit of kind of having, I guess, finding a happy medium. And so with that, you want to, when you change, you want to just make sure you do it slowly and introduce new things slowly so that it's not so you can adapt. If you can't adapt, that's when we have that injury. But we also have to be able to push ourselves in order to improve, right? And so that's where it comes. I think you have to kind of introduce it in increments that aren't too much, but enough to be able to challenge the body physiologically to then be able to improve. And so it does come down to, and that's what really helps, I think, distinguish your best coaches are those that are able to adapt to that and be able to see when an athlete needs to really increase volume or increase intensity and be able to kind of find that happy medium with both and then be able to do it without having an injury.
Changes in training are really important for continual performance increase. However, there's a very fine line between changing everything in our training and changing one factor at a time. For example, when we change mileage and we increase speed and strength all at the same time, this is a breeding ground for an overuse injury to occur. So with our coaches, with our athletic training staff, we get to work simultaneously together, and our personal trainers as well, on what levers are we pulling at different times to appropriately load these athletes to prevent them from having these overuse injuries. So for example, in mileage, something that I like to ask my athletes is, what has been your mileage increase if they're starting to show signs of overuse injury? Typically that mileage increase for everyday runners is about 10% increase per week. Anything outside that 10% can fluctuate. It depends on if we're dealing with a D1 athlete or someone that's just started running. In the collegiate setting, these athletes need to perform at a very, very high level. So yes, their mileage will increase. But with that, we don't typically see a strength and a speed workout back to back. We don't see our hardest speed and strength workouts right in the beginning when our mileage hasn't increased. It's typically a slower increase in mileage. And when we've built up that base to be able to get our aerobic capacity, our anaerobic capacity, the appropriation of muscle loading and tendon loading, then we're able, okay, we're ready to start some speed work. Then as we continue building that base with that mileage to back that up, then later we're able to increase speed or increase strength duration or increase reps in practice. So it's all about appropriate management with the change in surface that we've already talked about, with the change in footwear that we've already talked about. All those factors play into it, but with specific to training, it's got to be over time.
One injury that I've noticed with that is iliotibial band syndrome in both men and women. Iliotibial band syndrome can be a little more common with women because of this issue, and the issue a lot of times has to do with hip abductor strength. So more the glute medius more than anything, and that external rotation strength of the hip adductors. So what often happens is the hip adductors overpower the hip adductors. And so you have a change in the knee rotation because of that. And that puts more stress on the distal IT band, especially the junction of Gerdy's tubercle. And so that is one thing I've seen. And so what we try to do is recognize that. The other thing that I'll also notice is with those IT band syndrome pain is the flexibility of the IT band is not as flexible for those that don't seem to have issues with it. And so we work on the flexibility as well as really work on strengthening of the hip adductor muscle group. And that really seems to help the athlete to overcome the injury and prevent it from happening in the future. The other type of injury that same muscle group can be helpful for is patellofemoral pain syndrome as well. And the same type of thing, the knee is rotating more inwards and it puts more stress on the patella tendon. So really, if you're going to add some exercises just in general as a runner, that's a good hip adductor strength can be very important and helpful to do to kind of prevent injuries for both men and women.
With specifics to females, females have wider pelvic structure and typically have a greater Q angle than males do. This structure kind of looks knock-kneed, and with the knock-kneed structure, we're getting a lot of like IT band risk because of the way that our structure is built. We're not quite strong enough in the abductors. We're overloading too many muscles and we can't appropriately load ourselves how we need to. So with athletes, when we look at them, we look at varus structure, we look at Q angle, and we decide, okay, you can't change the anatomical structure of an athlete, but what are things that we can do to supplement them so that they're not constantly having all the forces against them when they're training? One of the athletes I really like to work with is our 800-meter athletes. They push off the ground with such strong force, and it's quick. And when they have such a vertical ground reaction, their foot structure is really, really important in the shoe. So a lot of my 800 runner athletes, when they come in, they're feeling pain in like a lower extremity. The first thing I do is I want to look at that arch. And I want to see, are we collapsed in the arches or are we too high in the arches? What is their anatomical structure? When we're collapsed in the arches, it's putting a lot of stress up that kinetic chain. And so with orthotics, most of our 800 runner athletes are using orthotics to correct that varus slightly. We don't want to completely change their anatomical structure, but just aid and support. This is going to prevent a lot of injuries for them that are overuse, like your plantar fasciitis, any tendonitis of the knee, even through the hip problems with IT band syndrome, hip flexor stresses. Just by changing the way that they're loading on those feet or not loading correctly on those feet can help us further help them. If that side is leading to an injury on the contralateral side or on that specific side, then let's look at, okay, they're giving 10% more here. Why? What's the why? Where is it an anatomical structure that we can shift, or is it a strength deficit, or is there something injured that's relying us to rely on that leg? I feel like in track specifically, they go one way around the track. So we're seeing injuries on either that inside leg or that outside leg because it has to catch up to that inside leg. So yeah, that would be something that would be very interesting that would help us confirm the why and further help these athletes.
So